Hello, this is Joshua McKinnon. I'm a family nurse practitioner student in the DNP program at UAMS. This is my pechukucha presentation to address transgender care in Arkansas. Arkansas gets a very poor rating for LGBTQ policies, especially when discussing transgender laws specifically. The policymaker I would like to work with is Arkansas Senator Greg Leding, who is up for re-election in 2022, and to propose a policy change for the 2023 General Assembly. As a health advisor, the issue we wish to address is ensuring access to transgender care to all patients. And to address this, we would like to start with repealing House Bill 1570, which is now Act 626. This act effectively prevents transgender minor patients in Arkansas from receiving gender-affirming care. We will address why this topic is important, why this bill is unnecessary and even detrimental to patients, and we will discuss the medical organizations that support the need for transgender care. So why is this important? The population of transgender in the United States is approximately 1 in 200 people. Within this population, approximately 40% have attempted suicide, which is 9 times higher than the general population. And this number does drop to the general population suicide attempt rate after receiving gender-affirming care. Transgender people also suffer from higher rates of depression, anxiety, eating disorders, self-harm, suicide, homelessness, physical violence, substance abuse, and high-risk sexual behaviors. And 1 in 4 transgender patients avoid necessary doctor visits due to fear of being mistreated. So this marginalized demographic needs support, not further hindrance to health and prosperity. So let's look at House Bill 1570. Act 626, and address some of the aspects that are unnecessary and potentially detrimental to patients. First, they state that the majority of gender nonconforming children come to identify with their biological sex in adolescence or adulthood. The bill does not cite any specific studies, but this is probably from an early and poorly designed study that grouped all children from a specific gender clinic together and made the conclusion that these children did not want to change their sex. This should have been expected because the gender clinic saw a diverse range of patients, not just transgender patients, and grouping them all together is just misleading. The bill also states that many gender dysphoric patients experience psychopathy, and individuals should be encouraged to seek mental health services. This is well documented and supported by medical organizations that gender dysphoric patients experience these higher levels of mental illness, and all organizations agree that patients should see a mental health provider if needed. The American Academy of Pediatrics state that there is no evidence that risk for mental illness is inherently attributed to one's identity of being transgender, but instead, mental illness is multifactorial and can be contributed to internal conflict between appearance and identity, discrimination, stigma, social rejection, and limited access to mental health services and healthcare providers with experience with transgender youth. Furthermore, the DSM criteria developed by the American Psychiatric Association has changed the diagnosis for transgender persons from gender identity disorder to gender dysphoria, a distinction that no longer identifies being transgender as a mental disorder. Third, the bill states that suicide rates, psychiatric morbidities, and mortality rates remain markedly elevated above the background population. This is simply not supported by research, and instead the opposite is supported. Mortality rates significantly decrease after receiving gender-affirming care. The bill lists a series of known risks of gender-affirming care, and these risks are well documented, and they've been found by many medical societies that the benefits still outweigh the risks. 5. Reassignment surgeries are generally not recommended for children. This is true. No organization recommends routine gender-affirming surgery for children, but decisions should be made individually and after other avenues of care are tried. Also, studies in transgender adults found that transgender individuals who have reassignment surgeries or partake in hormone replacement therapy, around 1% of them later regret their decision. The bill states that risks of gender transition procedures far outweigh benefit at this stage of clinical study. while multiple organizations make statements that not treating this population is not a neutral act, and delaying transition could have serious negative consequences. And finally, any referral for gender transition procedures to anyone under 18 years of age is considered unprofessional conduct and subject to disciplinary action according to Act 626. However, there are 11 medical organizations that have issued statements in support of transgender standards of care, issued by the World Professional Association for Transgender Health. So, what are these standards? First, for psychological and medical treatment of gender dysphoria, they suggest changes in gender expression and role, living as identified gender in appearance and use of pronouns, prescribing hormone replacement therapy for feminization or masculization, gender affirming surgery, and psychology visits to address gender role and expression and coping with stigma. The second suggestion is providing social support through groups, organizations, and healthcare providers. They also report that many transgender patients do markedly better if they simply have support from family and healthcare providers. The change. The medical providers should be free to follow the advice and support from the medical organizations when caring for transgender patients. This means there should not be laws in Arkansas that prevent providers from providing evidence-based, life-saving care. The risk of not supporting these patients is death and increased mental health issues, homelessness, substance abuse, as well as other issues. The risk for providing care is well documented and is manageable by the medical community. Thank you for attending my presentation. I hope that gave some people some information.